Well, thank you, Lade, not just for the warm welcome and the very incisive introduction to Focus Our Minds, but also for your leadership, which I greatly appreciate. And you were kind enough to say it's an honour and a privilege to have me. Actually, it's the other way round. It is my honour and privilege to be with you all today. Not least because behind all the facts and the statistics that Lade set out, and many others will today, there are thousands of lives cut short. Our brothers, our fathers, partners, husbands, sons and friends, and there are even more lives affected. And there has been a reluctance, I think, to accept that men suffer specific inequalities and hardships. And that's why, as Minister for Women's Health and for Mental Health, I want to start by acknowledging how easy I think it is to fall into a trap of thinking that the health of one sex should somehow come at the expense of another. But for me, it's not an either or. In my view, and you'll hear more about this in the forthcoming weeks from me, women's health has been neglected. Men's health has been neglected. And both of these things can be true at once. And it's a very significant event today, a real initiative, and I want to congratulate everybody who's been part of initiating it, organising it, and making it happen, because it is by focusing, as Lade has explained, that we will make change. There are, of course, people who come into mental health services where I want to recognise we continue to see what I regard as unacceptable inequalities, not least the disproportionate detention of black men under the Mental Health Act. So our government's plan for change committed to reducing the number of lives lost to the biggest killers, including suicide. So over the last 18 months, we've reformed the Mental Health Act, which dated back to 1983. We've published the first ever men's health strategy on International Men's Day last year, and we've partnered with the Premier League. So let me start with the Mental Health Act, and it is something that I feel particularly invested in and particularly proud of, as you should be, because after years of work across the mental health sector and championed by many people, many of whom have had to show great courage with their personal experience of severe mental illness, it was a privilege for me to take the mental health bill through Parliament and particularly through the House of Lords, where it started. It is the most significant mental health legislation reform in a generation. What will it do? It will strengthen protections and rights of people with severe mental illness, and it will create a foundation for change to address the long-standing racial inequalities that have disproportionately affected black men in particular. I'm very grateful to members of the Royal College and many others. You all devoted so much time, effort and expertise to what are vital reforms. And now the bill is law. Our next step will be updating the Code of Practice. And we continue to need you to help us shape this work. And I know just how deeply this audience cares about inequalities. Many of you have worked on initiatives like the Patient and Carer Race Equality Framework. And the PCREF will support trusts to improve their interaction with racialised and ethnically and culturally diverse communities. It will support trusts to raise awareness of their own cultural and racial bias. And it will support trusts with providing a framework to reduce those inequalities. Which brings me on to a broader point about achieving our goals through partnership. Earlier this month, I met again, I don't say it in a bad way, I say it in a good way, with Philip Pirrie, who lost his dear son Tom to suicide. Philip has gone through something that many of us can barely begin to imagine. But today, and not just today, but every day, he campaigns with determination, with dignity, to save other families and other fathers from going through the same tragedy that he has gone through. And that is what drives him. Well, it needs to drive us as well. Because what I've heard from Philip and other campaigners is the importance of bringing a broad range of services and organisations together into the conversation, not just the conversation, but into action. People don't and won't ever neatly always present at a mental health service. Nearly 3/4 of people who take their own life are not in contact with NHS mental health services. But what interests me is many are in contact with wider public services, as well as the private sector, presenting a great opportunity for intervention. So whether we're looking at sectors like transport, finance, justice, work, we have to seize every opportunity to point people towards help. And recently I brought together representatives from the leading banks. And what struck me was how much they already are doing, but how aware they are of how much more they need to do. They're the ones that hold the data on where people are getting into financial difficulty. They're the ones sending out the reminder letters that actually drive people the wrong way. They're the ones who can provide a package of support and guidance. And it is by working with groups like that that we can make a change. So let me turn to the men's health strategy. Men still live too much of their lives in poor health, and they die too young. Men are hit harder by a number of health conditions and can face barriers in accessing healthcare services. Now, I'm a big fan at looking at people as a whole person and not just a problem. And certainly not just one problem to be solved. And that's how the men's health strategy approaches this. For the first time, a government is taking comprehensive, coordinated action to address the health challenges facing men and boys. The real test for the strategy is, can we maintain momentum through 3 broad aims? First of all, making sure that health services engage men and boys and are responsive to their needs. Building structures that support men and boys to maximise their own health and well-being, and creating the conditions in which men and boys' health and well-being can thrive. But I do want to highlight, for the first time in our history, as I've said, this is coordinated action across a number of government departments on men's health. So if we look at the neighbourhood-based Suicide Prevention Pathfinder programme, this will operate in parts of England where we see the highest rates of suicide. In other words, we're not going to where there's least, we're going to where it's needed most. Co-designed with experts and people with lived experience. And for mental health practitioners, last year we published the Staying Safe from Suicide guidance and training. Over 5,000 mental health staff have completed and passed the training thus far. It takes a person-centred approach, and it will support all mental health practitioners to tailor their approach to the needs of each individual. So I want to thank the Royal College of Psychiatrists for their support and for encouraging the uptake of the guidance and e-learning amongst their members. And I do want to say, and it's not often ministers can say this, but I was absolutely staggered by the positive response that we had when we promoted it. And that's something Philip had urged me to do. And the response has been absolutely tremendous. So let me turn to partnerships, and in particular the Premier League. I'm excited by this partnership because this is about a Together Against Suicide initiative to help tackle male suicide as part of England's first men's health strategy. The work carried out with the Samaritans, to whom I'm most grateful, provides matchday support for fans in stadiums, as well as an online hub with information and referral details for fans and followers watching from home. That's about going to where people are, not expecting them to come to us. And football clubs will actively promote mental health and suicide prevention support, such as NHS talking therapies, Every Mind Matters, and guiding people to the right place for support. So we're harnessing the power of football and community to break down barriers and, as I say, meet men in the spaces that they trust. And this work extends to other settings as well, such as working with EDF Energy to pilot ways to support male workers in the workplace. I think the possibilities are endless. So many of you are on the front line here. You're on the front line not just for adult men, but for boys as well. And many of you will have watched Adolescence, I imagine. I actually had the chance to discuss the programme. Do we still call them programmes in this digital age? You know what I mean. I discussed Adolescence with the Prime Minister, because he, like me, was very taken by it. And he talked to me about how he felt as a father watching it. Yes, it was a work of fiction, but the problems it described were not a work of fiction. They were very real. And the thing that struck me was the prevalence of phones, their impact, and that of social media. I was talking before I came in with John and Philip about the generation of young people who've had such a tough time through COVID. Now they're contending with an onslaught of negativity online. That's why we're committed to improving the relationship of children with mobile phones and social media and ensuring that it is safer online. There is going to be a consultation. I hope that you will all feed into that when it launches. And together with the Department for Education, we're making sure that mental health support teams are in every school and college across the country. And we're also putting an extra £7 million into funding 24 early support hubs across England. They're places where young people can drop in for advice, for counselling, support, sexual health, education, employment, drugs, money worries, whatever it is on their mind. So we have to provide the right support early before problems escalate. So friends, this for me is a real moment today. It's a turning point. Because this day where we gather builds on the fact that we are now taking a comprehensive and coordinated approach to address the health challenges facing men and boys. It seems so obvious, but it hasn't been done before. But if we're serious, we have to work in partnership with each other, both within and beyond the health sector. Whether that's with education, whether it's for those businesses, local authorities, voluntary and community organisations, with criminal justice, everybody has a role to play in order that we can promote good mental health for men and boys and reduce suicide. I believe, and this is my responsibility, we have to organise our services around the reality of men and boys' lives. And we need to support those who work in the services to build that safety, that connection, and that hope every day. Thank you.